Hi, my name is Wesley Norris with the Wesley Norris Insurance Agency, and I operate the Medicare store located at 103rd Avenue and Indian School in Phoenix, Arizona. Well, if you're getting ready to turn 65 soon, that means you're going to be looking at retiring soon as well, which also means you're going to be looking at going on Medicare and or applying for your Medicare if you're already retired. At the Medicare store, we can answer all of your Medicare questions. Today, we're going to be talking about Original Medicare. Now, to qualify for Original Medicare, you must be 65 years of age or younger if you have end-stage renal disease or ALS, which is Lou Gehrig's disease. You must be a United States citizen or a legal resident who has lived in the United States for 5 consecutive years. So those are the qualifications for Original Medicare. Now, everybody starts with Original Medicare, and then they move on from there. So we're going to go over exactly what your benefits are under Original Medicare. Again, there are 2 parts, Part A and Part B. Your Part A will not have a premium because you paid for it through your 40 quarters of employment. The first 10 years that you were employed, you paid basically for your Medicare Part B. Your Medicare Part B covers hospitalization, skilled nursing facility care, blood transfusions, and hospice care. Now, on your Part B side, if you are not on a group plan when you turn 65, you are required to go on and apply for your Part B. If you do not apply for your Part B when you become eligible, there is a late enrollment penalty. The monthly premium for your Part B is $144.60 per month. If you're on Social Security, they will take it directly from your Social Security check. If you are not drawing Social Security, then what they will do is they will bill you quarterly for that $144.60. Your Part B also has a $198 deductible. Your Part B covers doctor visits, primary care and specialists, outpatient surgical procedures, PET scan, CAT scans, MRIs, labs, and x-rays. Pretty much anything that's done outside of the hospital. Now here's how your Part A benefits work. Under hospitalization, let's say January 1, you check into the hospital and you stay for 5 days. That's going to cost you $1,408. That is your deductible. It covers you for a 60-day period. So if you went back into the hospital February 1 for the same problem, you would not pay any additional money. However, if you went back into the hospital March 15th, you're beyond that 60-day period, so now you would pay an additional $1,408. Now let's go back to the first of the year again. You check into the hospital, 60 days later, your doctor is not ready to release you. So now you're going to owe $1,408 for that first 60-day period. Starting day 61, you're going to be paying $352 per day for the next 30 days. That is how your hospital benefit works. Your skilled nursing facility, you get a 100-day benefit period. Days 1 through 20 is a 0 copay. Days 21 through 100 is $176 per day up to the 100th day. If you're in there beyond 100 days, day 101, you will start paying for the full cost of the stay. And believe me, it's more than $176 per day. Medicare covers blood transfusions, but it says you pay for the first 3 pints. A pint of blood costs somewhere between $130 and $150 per pint. Also, hospice is covered under your Medicare as long as you go to a Medicare certified hospice. That's your Part A benefits. Your Part B benefits has a $198 Part B deductible. So let's go back to the first of the year. Instead of going into the hospital, you go see your doctor. He's going to charge you that $198 Part B deductible. After you have paid that, the plan switches over to an 80-20 plan. Medicare pays 80%, you pay 20%. So PET scan, CAT scans, MRIs, you pay 20%. Outpatient surgical procedures, you pay 20%. Durable medical equipment and prosthetic devices, you pay 20%. And again, unfortunately, original Medicare does not have a max out of pocket, which means if your health took a turn for the worse and you're going in and out of the hospital, having a lot of procedures, maybe some outpatient surgical procedures, you're going to be paying 20% each time. So that could be very costly. So your first priority is to see how to keep those costs under control. Your first option is a Medicare supplement plan, formerly known as a Medigap plan. Starting in January 2020, the most comprehensive plan that you can get is Plan G. Here's how Plan G works. On your Part A side, it covers your hospitalization all the way up to 365 days, zero out of pocket. It covers your skilled nursing facility care, 100 days, zero out of pocket. It covers your blood transfusion from the very first pint, zero out of pocket. Hospice is covered under Medicare A and B as long as you go to a Medicare certified hospice. Medicare does not cover prescription drugs on the prescription supplement plan. So you have to get a standalone prescription drug plan, which is going to cost you somewhere between $12 and $100. So you're going to need a Medicare supplement plan to go along with your Part A and your Part B to keep those costs under control. So here's how it works. Part A, a Plan G on a Medicare supplement plan is going to cover all of your hospitalization, zero out of pocket. It's going to cover your skilled nursing facility care, zero out of pocket up to 100 days. It's going to pay for your blood transfusion starting from the very first pint. As long as you go to a Medicare certified hospice, your hospice is going to be covered with a zero copay. Your Part B is going to have that $198 deductible. Once that's paid, it switches over to an 80-20 plan. Your Plan G will pay your 20%. My name is Wesley Norris with the Wesley Norris Insurance Agency. That's how your Part A and Part B works with original Medicare, and that's one of the ways that you can control your costs with a Medigap Medicare supplement plan. Again, my name is Wesley Norris. I operate the Medicare store located at 103rd Avenue and Indian School. If you have any questions, please do not hesitate to give us a call. Our telephone number is 623-224-4226. Hey, and if you like the video, please click on the like button and leave me a comment. And please subscribe if you would like to get the rest of our videos as they come out. Again, my name is Wesley Norris, and remember one thing, we take care of our clients every single day of the week. Have a great rest of the day.